Good evening, everyone. My name is Keith Moy, and I'm going to be speaking on the effects, long-term effects of fetal alcohol syndrome. And so I'll start off by defining what fetal alcohol syndrome is. And fetal alcohol syndrome is a condition that results from alcohol exposure during pregnancy. Problems that may be caused by fetal alcohol syndrome include physical deformities, mental retardation, learning disorders, vision difficulties, and behavioral problems. It's estimated that each year in the United States, 1 in every 750 infants is born with a pattern of physical, developmental, and functional problems referred to as fetal alcohol syndrome. Now, there's no evidence that exists that can determine exactly how much alcohol ingestion will produce birth defects because individual women process alcohol differently. But what we do know is that alcohol passes the placental barrier, and the fetus is less equipped to eliminate alcohol than its mother. So as a result, the fetus tends to receive a high concentration of alcohol, which lingers longer than it would in the mother's system. Also, women who drink in their first trimester of pregnancy have children with the most severe problems because that is when the brain is developing. So now that we've defined fetal alcohol syndrome, and talked a little bit about some of the specifics around it, excuse me, we'll go ahead and talk about some of the long-term effects of fetal alcohol syndrome. We'll discuss the biological effects, psychological effects, cognitive effects, social effects, and the spiritual effects as well. So starting with the biological effects, there can be low birth weight, small head circumference, developmental delay, organ dysfunction, facial abnormalities, neurologically, epilepsy, as well as a hindrance in the development of fine motor skills. Also, something biologically along the lines of failure to thrive. And what this is when kids fail to take in, retain, and utilize the calories needed to gain weight and to grow as expected. Psychologically, we can see behavioral problems, including hyperactivity, inability to concentrate, social withdrawal, stubbornness, impulsiveness, and anxiety. Oh my goodness, that's how you say that, anxiety. Sorry about that. Cognitively, we see learning difficulties, including poor memory, the inability to understand concepts such as time and money, poor language comprehension, and poor problem-solving skills. Socially, there can be poor socialization skills, which which leads to a difficulty in maintaining friendships and relating to groups. Now, spiritually, this can have an impact because if there's issues with poor problem solving and with the inability to understand certain concepts and with stubbornness and impulsiveness, this can make it difficult for this individual to make sound moral judgments and decisions. It also can create a hindrance around a proper ability to set healthy boundaries as it pertains to certain life choices such as drugs, alcohol, sex, and other choices that can lead to the compromise of that person's faith-based beliefs or their family's faith-based beliefs and moral system based on their spirituality. The resources that can be useful to families dealing with someone with FAS, or of course to that individual themselves, would be, of course, counseling and the support of the medical community as well, working together in unity to bring about the best solutions and to bring about just the best plan for the individual dealing with FAS and to bring about the best support and education for the family as well. Also, as far as the educational system, partnering with the learning specialists in the educational institutions to make sure that there is the proper academic plan in place for the individual dealing with this condition. Also in the home, parents can implement daily routines to which the child can become accustomed, also create and enforce simple rules and limits, point out and use rewards to enforce acceptable behavior, and just having positive role models and examples in the child's life to help out with those social skills and to help guide them and to support the plan that is being implemented. Well, this concludes my discussion on fetal alcohol syndrome. My resources have been kidshealth.org, as well as the mayoclinic.org, and of course our textbook development through life. Have a great evening, and thank you for your time.